on Addison's disease by Group 7. This disease was first described by an English physician named Dr. Thomas Addison, where the disease gets its name in South London in 1855, when he discovers a new form of anemia. He wrote about this discovery in the London Medical Gazette, but it wasn't finalized until his monograph in 1855, where it described how, when investigating a peculiar form of anemia, he found pathological changes in both suprarenal glands and that appeared to be independent of the anemia. Addison's is a rare disorder that occurs when the adrenal glands are not producing enough of certain important hormones. This condition affects 1 in every 100,000 people in the U.S. of all ages, within a global prevalence affecting between 40 to 60 million people. While individuals of all ages could be affected by Addison's, the average diagnosis age is typically between 30 to 50 years. Both men and women are equally affected by this disease. One of the leading causes of Addison's disease is tuberculosis, but in developed countries, this disease occurs as a result of an autoimmune disease. The adrenal glands are a part of the endocrine system and produce hormones that give instructions to almost every organ and tissue in the body. Here in the picture, you can see that the adrenal glands are right above the kidneys, and they produce the hormones that regulate stress response, sexual development and function, metabolism, immune system response, and blood pressure. Addison's disease is caused by damage from an autoimmune attack to the adrenal cortex or from damage from tuberculosis. This results in too little production of the hormones cortisol and aldosterone, since they are made in the adrenal cortex. The role of cortisol is to help maintain blood pressure, blood sugar levels, and stress responses. Aldosterone is a steroid hormone that helps the body retain sodium and water and excrete potassium. And this also plays a role in helping maintain blood pressure and volume. Due to little production of cortisol, when a person with Addison experiences stress, they may also go into an Addisonian crisis. Right here you can see part of the adrenal gland, and this is the adrenal cortex, and you can see that aldosterone and cortisol is being excreted. And here you can see the Addison crisis pathway, where here you start with the adrenal glands not functioning properly due to low aldosterone and low cortisol, and you can see the chain of effects that lead from these events. So aldosterone goes all the way to shock, to brain or death. Cortisol, same thing, brain, coma, and death. Addisonian crisis is a life-threatening situation which results to low blood pressure, low blood sugar, and high blood potassium. Here you can see the different symptoms, which include restlessness, confusion, being afraid, dehydration, extreme weakness, trouble staying awake or total loss of consciousness, a high fever, lightheadedness or feeling faint, hyperpigmentation, which is caused by an overproduction of ACTH, which is attaching to the receptors of the melanocytes, severe vomiting and diarrhea, and sudden deep pain in lower back, abdomen, or legs. A diagnosis of Addison's disease is commonly made by using the adrenocortical hormone stimulation test that measures the amount of cortisol present in the blood and/or urine after a dose of synthetic stimulating hormone, ACTH, and is administered to the patient. The ACTH stimulates the production of cortisol in the body. A normal test result should show cortisol secretion. Addison's disease will involve the test failing to cause cortisol secretion. Here you can see that the ACTH is trying to go into the adrenal gland but can't. Therefore, there is no cortisol secretion from the test. People who have Addison's disease will need to take medication for the rest of their lives, but they can live normal and healthy lives. They will be given hormone replacement therapy to correct levels of steroid hormones the body isn't producing. Hydrocortisone is used to replace cortisol, and mineralocorticoid replaces aldosterone. Additionally, doses of cortisol can be taken when experiencing acute illness or injury. If left untreated, cortisol levels can become dangerously low, which can ultimately lead to adrenal crisis, or also known as Addisonian crisis, which we mentioned earlier. Symptoms of Addison's disease includes extreme fatigue, weight loss and decrease in appetite, darkening of the skin, which is hyperpigmentation, low blood pressure and fainting, salt craving, low blood sugar or hypoglycemia, nausea, diarrhea or vomiting, and abdominal pain. With applicable cure and compliance, patients with adrenal insufficiency or Addison's disease can live a regular lifestyle/lifespan without limitations. However, the prognosis for an untreated affected person is poor. Some research has observed that those with very excessive concentrations of cortisol have a worse prognosis and a greater compliance fee or secondary sepsis or intestinal perforation. And here's our teamwork distribution. And that's it. Thank you.